For some reason, I had to click it and tell them that I was. Okay, there it is.
Very
All
good.
right, so now it says that we are actually live. Hello, everybody. So I clicked all the things everywhere else, but looks like I didn't click it over here on this end. So now we are officially live, and I see that the time is now moving. So without further ado, like I stated, I am Dr. Ashley Booth, and welcome to Lessons Beyond the Stethoscope. And here, what we do is we provide information and tips so that you can not only navigate this complicated healthcare system that we have, but to be able to use this information to live your best life. That is our ultimate goal. And so, joining us today on episode 2, What to Expect from the Pharmacy, is Dr. Victor Allen. And Dr. Allen is a pharmacist here in our Savannah area, but he was born and raised in Jackson, Mississippi. And if you know me, you know that I love Jackson, Mississippi. That is where I did my residency. I got some excellent training there. But not only that, I met some awesome, awesome people there. Jackson has like a super soft spot in my heart. I absolutely love it. Love the people there, love the culture. And so when I met Dr. Allen, I already knew he was good people, right? Because he's from Jackson. Just good people are from Jackson. So know that you are in good hands because Dr. Allen is here. So he not only was born and raised in Jackson, Mississippi, but he did his undergraduate work at Jackson State University and he got a degree in biology. And thereafter, he was working as a pharmacy tech and loved that field and decided to pursue his degree a little bit further and went to South University School of Pharmacy and became a pharmacist. And he did his training here in Savannah, Georgia. So currently, he is because I keep wanting to say chief, but it is, but still, that means, but he is the pharmacist in charge at the J.C. Lewis Primary Healthcare Center. And not only that, Dr. Allen is not all business all the time. He does like to get out and enjoy himself. So he does some outdoor activities and things of that nature. He even told me that he likes to do karaoke. So he might sing us a little something today. I don't know. Maybe Doctor, we can get that. He's like, no, we're not doing that. But I just want to let you guys know that Dr. Allen is great people, and I'm so happy and so honored that he decided to come and share some information with us today. So please welcome and help me welcoming Dr. Victor Allen here on today.
Thank you so much, Dr. Booth, for having me. I'm very elated to be talking to the people about pharmacy and trying to, clear up some things, and make sure that, everybody has a smooth transition when leaving offices like yours and coming to the pharmacy. So thank you for having me.
You are welcome. So listen, this is the thing. I was talking to Dr. Allen. I said, I thought I knew some things, right? And I thought I knew the pharmacy and kind of how things worked. And the more we talked about it, I was like, I didn't know that. I didn't
Right,
know that
right.
either. And so I was so happy that he decided to come on and discuss. So we're going to talk about some things such as what happens when that prescription leaves my office and the doctor's office and it goes other places. What happens when it does that? What happens when your medication is not there? What do you do in those types of situations? If you need a refill, what do you do in that situation? Then there's the question of discount cards. There's all these different types of discount cards. Do they really work? So we're going to dive into that. And I think the easiest way for us to do it and to try to simplify it as much as possible is to just start at the beginning. And for me, that is at my doctor's office, right? So what happens is a patient comes in and I say, oh, yeah, I think this will be a good treatment for you. I'm going to send it to the pharmacy. And nowadays, we don't do those hard copy prescriptions anymore. We typically send it to the pharmacy because we have these electronic records. So I send it like a fax, and that's essentially what it does. And it faxes and it goes off. And in my mind, it's at the pharmacy. There are a few times that I'll get a notification and they say the fax failed, it didn't go through, you need to resend it. But for the most part, if I send it, I believe that it's there. But then I get a notification from the patient and they say, mm-mm, it's not there. And I have to go back through this process again and send it again. So, Dr. Allen, when I send that prescription to the pharmacy, what happens on
So
your end?
basic, so basically, what happens is a lot of people don't know this, but each prescription that goes through electronically, it goes through some type of verification process to make sure that it's from a legit doctor's office, to make sure there's no issues with it or anything like that. For example, there's this company called SureScripts that we use, and I think majority of pharmacies, if not all, use SureScripts. But it goes through there and it just basically wants to do all the checks and make sure this is legit. And sometimes what I tell patients, and prior to me working where I work now, I didn't know. Sometimes they can take up to 45 minutes before he even gets done with their verification process and hits your pharmacy. And I only know that just from actually tracking it myself, being able to see it because I work at a healthcare center now, I'm able to see it and track it. Um, so yeah, sometimes you may have to wait to go to the pharmacy to get your prescription. It may not be immediate. You know, your doctor may tell you I just sent it, but it still has to go through that verification process. Not only that, 9 times out of 10, your pharmacy is really busy and you have scripts coming in from everywhere. And with that being said, you know, it may take a little bit longer before the workers inside of the pharmacy can even get to your prescription. Um, on top of things like when you think of Wi-Fi and all of these things in the cloud, you know, that affects it as well. So that's why it's always, you know, great to just give your pharmacy a little bit of time before you go ahead to the pharmacy right after your appointment.
So, what you're telling me is that they should not head directly to the pharmacy. They
That
could probably take a little pit stop. They could probably stop and then go, because the likelihood of it being ready right at that moment is unlikely.
that is very unlikely, yes.
Very unlikely. Okay. So what is the average time that you think that it takes for that to happen?
So,
Should they give like maybe at least an hour or so? What are your thoughts?
and that is hard to say because it typically depends on the pharmacy itself. You have some pharmacies are busier than others, but if you want to give like a standard all about time, I would say about an hour. That would be a good time. Just because again, sometimes it can take up to that 45 minutes, and then a lot of pharmacies are pretty quick, or they try their hardest with their workers. They can get it out in about 15 or 20 minutes after they got it. If you know really need it that bad, they can get it for you. So yeah, I
Okay.
would say about an hour.
So let me ask you this,
Hmm.
because I don't think that people quite understand, and I didn't understand it either. So I'm people at this
Hmm.
point. Okay. How many could you quantify about how many scripts do you guys get in an hour? I know you're at JC Lewis now, but before that, you were working at a busy chain pharmacy and
Hmm.
you guys were very, very, very busy. And not only are you getting scripts from electronically, you have to also answer the phone because doctor offices are calling and they're calling those scripts in on the phone. So you have to do those. And
Hmm.
then you do still have those people with those hard copies and they're coming in with those hard copies, and so you have to process those. So how many do you even can you even quantify about how many you get maybe even in an hour of the scripts that you guys are processing?
You know, I've never thought about it in terms of how many within an hour. It's kind of hard because the pharmacy is so unpredictable how your day is going to go. You can have a day where it feels like the entire city goes to the doctor's office that day versus days where it feels like everybody's at home. I know typically in the past we look at it more so about how much you do more so on like a monthly basis. You know, I've worked at stores that do about, let's say, 2K in a month. I worked at stores that did 800 in a day. So it all
Mm,
just depends on the area that you're in and where you're working.
got you. Okay.
Hmm.
So as you guys can see, they have a large, like you said, depends on the pharmacy. But not even just the volume of what's coming in, we also have to think about the staff, because you're the pharmacist and you have to kind of go through a lot of those things. But then you have your pharmacy techs that are also helping to assist you to go through these medications. The other thing that I thought about, and I don't think other people also realize, is that as a pharmacist, you guys are not just, okay, this is the prescription, check, I'm going to go ahead and approve it, and it is what it is. But you guys are actually cross checking things, right? Like, if you see two prescriptions of the same type of medicine come in, okay, which one do they want? The higher dose, the lower dose? Like, I need to call and verify that with somebody.
Correct.
Or if a medication comes in and you guys you're privy to their allergy list, and you say, wait, they're allergic to this, or their medications may have something in it that could be an allergen. So
Hmm.
then you guys have to do that. So you guys have a lot of things that you have to do. It's not just the medication comes to the pharmacy and then I approve it and then we put it in a bottle and then here you go, right?
Right, correct. That is very correct.
Okay.
Very. There are a lot of checks that we have to do as far as, let's see, like you said, drug interactions, drug food interactions. I mean, things such as you got this medicine from this doctor, and you saw this doctor. Oh, these medications interact, or oh, they're two different doses and two different doctors. Which one's your primary? Which one are you seeing temporarily? It's a whole bunch of things that we have to check to make sure, just to make sure you are your best self.
Gotcha. The other thing that I wanted to touch on too is that with COVID, and I truly empathize with a lot of the healthcare workers, but the people that I was really empathizing with too, and I don't think people understood, were pharmacists, because you guys started to have more responsibilities, or an increase in your responsibilities, and one of those were like vaccines. So if you are taking time away from doing those checks and balances that you just discussed to now give a vaccine, then that also can probably, does that slow down the process just a little bit, because now you have to kind of take time away from that, go over and do their, vaccine, and then come back. And even with the
Hmm.
vaccine, it's not like they just give it to you. They have to write down all the information, make sure that it is safe. Like, there's a whole process with that. And so once I saw that, I truly empathize, especially, I'll just speak for myself, when I had to take myself and my daughter to get her vaccine. And I was just like so appreciative to the pharmacist, because I was like, this is a lot. You guys have a lot to do. And then the other thing is consultations. Talk to me about that part of it, because that's another thing that you guys do. Patients come up to the window, what
Hmm.
should I take? How should I take? Or even outside of that, sometimes I've been given a medicine and then they say, oh, the pharmacist wants to talk to you. This is a medication that you should, they need to tell you about some of the side effects. Are you aware? Do you want to talk to the pharmacist? Like, so you guys, there's some things that you say, I need to talk to this patient to let them
Right.
know what's going on.
Hmm.
And then sometimes you're doing your work and then somebody else comes up to you and says, hey, I saw this out on aisle 5. I want to know, can I take this? So talk to me about that process.
So with consultations, I mean, it's all part of our job. We want to make sure that you're safe and that you're taking, the things that you're supposed to be taking, making sure nothing interacts. There's some time where we will not have to contact the doctor's office, um, per se. For example, let's say you have an allergy to amoxicillin. A lot of people have this allergy. Well, the doctor may put you on something called cephalexin. Cephalexin has about a 10% chance cross reactivity rate.
Mhm.
Basically, you have 10% chance of having a reaction. That's something that we per se don't have to call the doctor about. We just want to talk to you to see, are you okay taking this? You want
Hmm.
the chance that, and 9 times out of 10, that doesn't bother anybody, that specific one. But it's things like that to where we just want to make sure, like you said, everybody's safe. The consultation windows are always open if you have a question about anything regarding your medication, some medication you saw in the store, anything like that is basically there for your help, so we can help you.
Gotcha. So let's switch gears just a little bit. And
Mhm.
now we have refills. So we got the medicine. We understand that it should take a little while before we get there. Now we need a refill. And so I look on my little bottle and it says zero. Who
Hmm.
am I supposed to call? Am I supposed to call the pharmacy and get an authorization and then you guys do my refill? Do I call my doctor's office? Who do I call in that situation?
So typically, and that's been a whole debate, but what I would say is call your pharmacy first because there's a whole systematic process that's already set up. Um, you call your pharmacy, you call in a refill, the pharmacy gets it ready. You call in a refill, I don't have refills. Well, me or the pharmacy team, let me send this off to your doctor so your doctor would know that you need refills, um, because your doctor's already seen a lot of patients. They may not have the time to necessarily send you that refill right away or answer
Mm,
that concern right away. And so it's always best to let the pharmacy handle it. We check on those all the time, daily. We always have things coming in. We have checklists. Um, 9 times out of 10, we will not forget about you. I know I will not forget about you. I want my patients to make sure they get what they need and that again so they can live their best self.
yeah.
Um, as far as the refills, again, sometimes the doctor's offices may not be able to handle it right away. And so you may have to wait a couple of days, but that is why we urge patients to please call in your refills, not on your last pill, not on your second pill, but a couple of pills beforehand, just to make sure in case something like that happens, you won't have to go without and you're going to be okay. So that's very important. So not always push patients. Um, Here, I tell them do it about 5 days in advance.
Okay.
Just so 5 days is just a good number because with life we have so much other things going on where we may call it in a day, may not can't get to it the same day. It happens to me. I'm a pharmacist, but I have so much going on. But just kind of be cognizant of that when you're calling your refills. Just call in ahead of time, and then if there's an issue, just trust that your pharmacy team will work it out and let you know what's going on because they most definitely will.
So then let me ask you this question.
Hmm.
When it comes to the refills, and let's just say I didn't pay attention and it's a oops, my bad. And I looked and this is my last pill. And I'm used to the pharmacy sending me a notification saying that you have it. I wasn't paying attention. I didn't get that notification. And then I look on the bottle and now I see why I didn't get the notification because I don't have any more refills. Which certain medicines can I get like an emergency fill until you guys can contact my doctor and they give me an actual prescription? How does that work?
So with emergency fields, some state laws allow us to basically supply patients with what's called an emergency supply, which is supposed to be a 3-day supply of medication
Mm.
that'll get you over into your doctor's office are able to respond and get this medication back to the pharmacy for you. Most states cut it off at 3 just because, they want to give your doctors time to see it because, again, your doctors are doing a whole bunch of other things. Now, with that emergency supply, 9 times out of 10, that only applies to maintenance medications. So, blood pressure, high cholesterol, diabetes, medications like that is typically not done for things as, naproxen or some type of anti-inflammatory or some type of muscle relaxer, things that is going to make you well when it comes to things like, again, blood pressure, cholesterol, etc. So keep that in mind when you need an emergency supply. Also, with an emergency supply, typically when pharmacies do an emergency supply for you, those 3 pills or that 3-day supply comes out of your next fill. So if you get an emergency supply and 3 days later you finally get your script, let's just say it was 30 tablets, where you're only going to get 27 because you already got 3, which is considered that emergency. It's kind of not like a freebie, if that makes sense. It still comes out of what you already had. You just didn't have to pay anything for that 3-day supply.
Okay, that's very good to know because I didn't know that it came out of like their future script. I thought
Hmm.
it was like a separate thing, but it does come out of that. Okay, all right. And then the other thing that I know people have a question about are discount cards. So there are different ones. You have different stores have their discounts on certain medications because they want to save you money. So if you're a customer there and you get their sometimes you have to buy into their program and then you can get your prescriptions cheaper that way. The other ones, you have these generic cards that they send me. One of them is like GoodRx. There's all these other different companies that send out these discount cards that you can use for your medications. And then you actually have drug companies So the actual drug, it might be new, it might be really pricey. And so what they will do is they will give a discount to try to help you save on those medications. How do those work, and do they really work? And how does that whole process work?
So discount cards, they do work. They do provide some type of aid to patients who are looking to get medications a little bit cheaper. I do support them. They do sometimes hurt pharmacies because pharmacies, typically the way pharmacies make their money isn't by copays, it's by reimbursement
Mhm.
via insurance. But you know, the pharmacy staff, we want to help you as best as we can. So typically, even though we aren't allowed to look up discount cards for patients. You may have some of those that might do just because we love y'all like that. But
Okay.
um, they do work. I would say with discount cards, be careful though. For
Okay.
example, you know, the most popular one is GoodRx, and they have a whole app. 9 times out of 10, once you see it, that price is going to be what it is. But there are also some times where that price can be a little different. It can be a few cents higher. It can be a few cents down. It can be $1 higher. It's not 100% correct. So if you do pull up a GoodRx and you get to the pharmacy and you use it, and it's $2 more than what the GoodRx says, that is possible. They are able to change their prices or what your copay is going to be on their medication just like that. Um, Also, with the other discount cards, just be careful of the wording of them. I've seen plenty that has a big bright 80 on it percent, and a lot of people don't just pay attention to the wording. And it says, if you look real close, it's like a
Mhm.
really big 80, but really tiny words up to
Mhm.
80%. Not 80% off, but up
Right.
to
Up
80%.
to.
So just make sure, you know, once you are, or if you're going to use a discount card, you kind of just look at it overall to make sure you have an understanding of what you're possibly going to have to pay with discount cards. There's another type of discount cards that I want to talk about. They're called manufacturer's coupons. And what these coupons are is they're cards provided by manufacturer companies that try to help reduce costs of some medications, especially those pricey ones like Eliquis or some different type of
Mm.
insulins or things like that. Not all manufacturer companies do it, and sometimes there's some criteria. They typically don't do if you have some type of federal insurance, they won't help out. And sometimes you typically have to have a primary insurance, and they will kind of be billed as your secondary, if that makes sense. There's some where they'll maybe give you a first month supply free until you know you can figure out how you're going to go about getting this medication. It's all depending on the terms with that company and that card. Typically, if you're taking the medication, if you look at the manufacturer of that medication, you can go to the website and see if they offer some type of assistance if the medication is too costly for you.
Okay. That's good to know. I
Mhm.
really appreciate that because the I guess the other question, and I like what you said, that some of the staff will try to help you save money, because I went to the pharmacy one time. I had a prescription that I needed to get, and I was like, I go because someone said you gotta have it. It was an EpiPen. So I was like, okay. I was dragging my feet about getting it. And she was like, listen, you better go and get it. So I was like, okay, I'm going. So I go to the pharmacy and they said $300. I was like, wait a minute. Epi used to be like, I thought $10 or something. Then, I throw in, but I got insurance. Like that,
Yeah.
it didn't cover anything. So I was
Hmm.
like, oh my gosh. But then I found out, I had a nice person who told me, listen, go online, go to their site. They actually have a coupon that you can apply. And so apply that coupon to it, and you bring it back up here to the pharmacy. We'll apply it for you and put the information in, so that way we can give you a discount. So I really appreciated that. But I think people also have to understand, some of those things too. Like, there are multiple places that you may have to look, but depending on how much that script is, if it's going to
Right.
really save you something, then I
Hmm.
say try it and see what you can get. So I want you guys to, like I said, I want this to be interactive. If you have questions, we're definitely going to do what we can to answer them. One that came in is for Dr. Allen, and they said that patients who have a hard time opening traditional medication bottles, is there an alternative that they can ask for?
So I know within the state of Georgia where I practice, we have something called, the easy child caps, basically to where instead of having to push it down and twist it to get the top off, it's just a flip on, flip off. We are not allowed to offer those. Those have to be asked for. And then on your profile, we would indicate you always want those easy get off top, so it'll be easier to open your medication. And the reason patients have to act and we can't offer is all has to do with the law that came out years ago, where children were getting inside the medication bottles and were just taking things, it looks a lot of medication look like candy to children. So someone were just ingesting it and things were happening. And so that law came out to kind of protect that from happening. That's why maybe it's so hard to get medication bottles open when you have to twist and turn and do all of this. So for an easier cap to open, that's something you have to ask for. It's called a easy cap or easy open cap. Everybody has a different name for it, but just explain to where you can just flip it off instead of have to twist it down, and your pharmacy should be able to help you out.
Perfect. That's awesome. And then since you mentioned that, the other thing, I wonder, I know at one time there used to be the pill packs, and I'm not sure quite how that works. I knew that for patients, some patients would have the containers, right, where they would
Hmm.
put their medications in and all that. But some people, it still got to be a little bit too cumbersome. There used to be a company out, not sure if they're still out there, but they would you send the prescriptions to the patient or to that pharmacy or whatever that company, tell them how the patient takes the medicine, and then they would just pack them up in these little pill packs and they just peel it off and they would take them like that. Do the local pharmacies do something like that you know of?
So 9 times out of 10, the local pharmacies do not, just with all of the things that they have going on. I think back in the day they offered that, but pharmacy has just increased so much with what we have to do. It's just kind of impossible to do. Now I know with most insurance companies, they offer what's called mail order pharmacies, where your
Mm,
insurance can mail your prescriptions to you. And that may be an option if there's something that you're looking to do. You can contact your insurance company if you wanted to do the mail order pharmacy. They possibly could package it up for you like that. But as far as the local pharmacies, no, they no longer do that.
okay. Another question. Listen, these people are now they warming up to us, Dr. Allen.
I'm
They're
glad.
starting.
I'm glad.
I told you guys, Dr. Allen is good people. So feel comfortable, ask your questions, because how often do you have access to a pharmacist and a pharmacist who's going to keep it real and tell you what you need to know? So,
Yes.
another question that has come in that says, if a medication has like pork products in it, I'm gonna read exactly what it says. It says, "Can we know if meds have pork products as a capsule?" Oh, okay. To get an alternative. So, do they make the capsules out of pork products that you know of?
So I know some medications, especially when it comes to capsules, are made with like the animal products,
Okay.
gelatin, and a whole bunch of other things. Typically, there are some that are made that way more than others that we know off the top of our head. But as far as the actual ingredients, they're always on the manufacturer bottles that we have in the pharmacy. So my advice to that would be just to ask your pharmacist to double check that for you to make sure
Okay.
that that's not what you want, and if there is an alternative, because there's different manufacturers for every medication. There's some pills that it may be green at one point, and you get another point, it may be white. The different companies that make
Mm.
these medications. So just ask your pharmacy team, and they definitely can check that for you. More specifically, the pharmacist to be sure for that one, and they can check for you and make the necessary change.
Okay. Now that is good to know. I didn't even know about this. See, I'm learning something myself. So just talk to the pharmacist and see how you can get an alternative. Listen,
Hmm.
this is good. You also touched on a point that I want to know if you can touch on it a little bit more. You just mentioned that those pills can come in different colors, things like that. Because what happens to me is people say, "Oh, I used to take this little blue pill, or I used to take this little green pill, and now it's
Right,
white, and
right.
it used to be
Hmm.
this size, and now it's this size. Can you tell me what I took?" And I was like, "Mm-mm, I have no idea." And we used to be able to, at least some
Hmm.
pills, they used to be like a pill that's like an image thing, and we could try to figure out what you were taking then.
Hmm.
but they change so frequently now. Can you touch on that a little bit as to why someone may have had a green pill last month and now this month it is blue or white or something like that, and is it still effective or as effective as the other one that they used to have?
So I can guarantee you that medication is most likely still effective. There are maybe two, three medications where if you take maybe the brand versus generic, that's going to have an effect. I know that comes up a lot with Synthroid. But
Okay.
other medications, typically they're going to be effective. The reason for the change is most pharmacies have what's called like their preferred manufacturer,
Mm,
and we try to stick to that what we get, but sometimes the manufacturer isn't going to be able to supply us with said same manufacturer and may have to switch it up and tell, oh, we're sending you something different. Therefore, we have to give you all something different to keep your therapy going to make sure your levels are doing good and going down. It's not a random change just because we felt like it. It's just that's what was available at the time. Now, if you feel like you are having some type of reaction to it, or if it's not what's going on, then yeah, you can always come talk to the pharmacist and let us know. We would be more than happy to just try to get you another manufacturer or get back to the same one if it's available, or talk to your doctor about switching you to something else. Because again, at the end of the day, it's all to make you all comfortable.
perfect. Well, I think that's all the questions. That's all that I see. And pretty much what I've learned today is that I do not need to go directly to the pharmacy when my doctor tells me that they have sent my, it's because my medicine has been sent to the pharmacy. Doesn't mean that it's going to be ready when I get there. So to at
Right.
least give them an hour. If it's not there, then, and that's the other thing I also wanted to mention. If your medication is not at the pharmacy, you call the pharmacy, they say, we don't have it. Because I had this happen recently with a patient. I said, well, then call our office back. You need to call your doctor's office back, especially if it's a new medication. If it was just a refill, then like Dr. Allen said, sometimes your doctor's office will, I mean, your pharmacy can then get a hold of your doctor's office maybe quicker than you would be able to. Because I
Hmm.
called the doctor's office recently on behalf of a patient. And while I'm waiting, they had kind of like a recording that went through and it says, give us X amount of time. If this is a refill, call your pharmacy. That was
Right.
the first thing
Hmm.
that they said. If this is a refill, call
Okay.
your pharmacy. So in that case, then call the pharmacy. But if it is something else that was new, you need to call that doctor's office back and say, hey, they didn't get it, so that they can figure out what happened. They may need to get on the phone and call that script in and
Right.
do it that way or whatever. But know that when you get there, it's not going to automatically be ready.
Hmm.
Give it about an hour or so. Give your pharmacist some grace because they are doing a lot of things to make sure that you are safe. They are cross checking and making sure that your medications are not interacting with the wrong things. So they are actually doing something. They're making sure that you are going to be safe and that this medication is going to do what it needs to do for you and not harm you. The other thing is, again, if you have those refills, call the pharmacy first, let them see if they can handle it. If the other thing I noticed is with some patients, they will call the pharmacy and then they will wait and say, okay, I'll call the pharmacy, I've done my job, I'm good. But the thing is, if your fax, because we talk about how my fax didn't go to the pharmacy, but if the pharmacy's fax didn't come to my office, I don't know that either. So then if you wait a day or two and you still don't hear anything and the pharmacy still says that they don't have it, then you probably need to go ahead and call your doctor's office directly because maybe they didn't get the message or something happened. So go ahead and do that. The other part is the discount cards. That was a mystery. They do
Hmm.
work. You just
Hmm.
got to use them correctly and sometimes be very nice to your pharmacist and their staff because then they could probably help you out with some more information on how to save money because that's what we really want to do as well too because that makes me well if I can save some money that definitely makes
Right.
my life
Definitely. Hmm.
that makes
Definitely.
my life a little bit better. Dr. Allen, is there anything else that you would like to say?
I just want to say again, thank you for having me. I'm so glad I was able to talk to people about pharmacy and the things that go on from our perspective. I hope this was very insightful to everybody. I believe Dr. Boo put my LinkedIn information with the invite. So if you all ever have any questions, please feel free to message me on there. If you have questions, feel free to call JC Lewis Pharmacy. Just don't get a little crazy with it, because I do have to take care of patients here. But, I'm open for questions if anybody ever wants to talk.
Awesome. Thank you so much. And I have someone who is likely going to forward this to their daughter. And like he said, because they said their daughter wants to be a pharmacist.
Okay.
So now being able to see you and knowing that you did it, that's awesome. And I know that Dr. Allen is very open to talking to them about that. So, like he said, reach out to him on LinkedIn. Your daughter, look him up on LinkedIn. Let them know like what they're interested in and that sort of thing. And I know he will be able to try to help guide them and show, because the other thing is mentorship.
Right.
Mentorship is very, very, very important. And I know that I would not have gotten to where I am if I didn't have somebody who had already been that direction and try to show and lead me the way. So definitely reach out to him. I have a feeling that we will be seeing Dr. Allen again and he'll be talking to us about some other things. But like you said, reach out to him for some of those immediate things that you have, and we might come back and come up with some other ideas and topics that we can talk about. But thank you, Dr. Allen. I really
No problem.
sincerely appreciate you taking the time, because as you guys can see, Dr. Allen is at work and
I am. About to open the pharmacy doors.
and I told him I actually liked his other view better, because you guys could actually see he's sitting like in the pharmacy. You can see some pharmacy things behind him. So Dr. Allen took time out of his day, you guys, to tell us some information that I think will be very, very important. So thank you again for being here, you guys, and tuning in to watch him. If this was really informative to you, which I see a lot of you have said, be sure to share it with other people, because pharmacy, we
Please,
all
please.
have to deal with it at some point or another. We all have to interact with the pharmacy and the pharmacist. So be able to send this out so that other people can get some of this knowledge as well. Thank you guys again, and I will see you soon. Thanks, Dr. Allen.
No problem. Thank you. And thank you all.